I'm Ashley Anderson here with Dr. Robert Harrell of the Charlotte Headache Center, and today we're talking about some new and exciting advances in treatments of headaches.
Right.
Can you talk a little bit about what's going on over at the center?
Charlotte Headache Center, we started back in 2011, and it was basically founded to introduce some new technologies that have become available to treat patients with chronic headache and chronic migraine problems. What we've found is that there are a number of patients out there that are suffering with chronic head pain that's related to their oral function. And so what I mean by that is there are patients that are clinching and grinding, patients that may have issues with bite force balances in the mouth that we can now measure with some specific digital tools that we have and prescribe some treatments that will help to alleviate this chronic daily pain.
And are you finding that some of your patients don't know the source of their headache until they see you?
Exactly, and that's what's really interesting about a lot of these patients is they've been to see so many different medical providers, and no one really seems to be able to find the solution to their problem. Medicine, traditionally, they like to use different pharmaceutical agents to treat pain problems. So, for instance, a patient might see a medical doctor or neurologist, and they prescribe different combinations of medications, and we call that the pharmaceutical gerbil wheel. And many patients have been on that for years and years, and what they find is that the relief they receive from the medications is minimal, and sometimes they build up tolerance to these medications over time, and so most patients would prefer not to have to take multiple medications on a daily basis to treat their pain. The alternative, and what we really try to look for, is how can we find the source of the pain? And so with some of the screening tools that we have, we're actually able to measure what's happening in the mouth with the bite forces. We can look inside the patient's mouth and see, do we have a history of worn teeth, broken teeth, buildup of bone that would tell us that they're clinching and grinding over time. And what happens for those patients is the clinching and grinding and the imbalances in the bite will create muscle injuries in the muscles that control chewing function. So we typically see temporalis muscle, masseter, and pterygoids here beside the jaw. Those muscles will become quite sore, and really we would more accurately classify those muscles as being injured. And so what happens when we can diagnose a patient with these specific set of conditions is that we can apply treatments that we've actually borrowed from sports medicine and physical therapy. So, for instance, if you'd injured your leg and you went to the doctor, they might say, Ashley, you need to go to the physical therapist, and they're going to work on you week in and week out to try to get these muscles and joints to heal. Well, we do the same thing, and it's applied in our headache center. We use treatments that, again, originally developed for sports medicine and physical therapy, but when applied in the right combinations with the right frequency, we really can get these patients to improve.
And is there ever a case where you need to do some dental work to fix the problem?
Well, and that's a great question, because the origin or the real source of the problem is what happens when the patient brings their teeth together. So whether that's clinching and grinding, whether it's chewing function, so we definitely have to take the dental component into consideration, and that's why these treatments are best performed under the care of a dentist, because there are certainly a number of things that we may have to do to correct the occlusion or the way the teeth are functioning together.
Imagine so many people out there suffering from headaches, and all they need is a visit with Dr. Harrell. And who would have thought that your headache could be connected to problems in your mouth?
And you know, that's what a lot of patients say. It's very easy. We offer a screening consultation appointment that takes about 20 minutes, and usually within that time frame we can either establish that that patient is or is not a good candidate for our treatment. So many patients out there suffering. The consultation's pretty quick and easy. We can rule in or out within about 20 minutes whether they're good candidates for treatment.
And is this a long-term treatment procedure, or is it a short-term fix, or does it vary?
So it can vary depending on the severity of the problem. So just like we mentioned, if you had an injury in the leg or an ankle and they send you to the physical therapist, those are typically treatments that would go on for a period of weeks. In our office, typical treatment plans will range anywhere from 6 weeks, sometimes up to 18 to 20 weeks, depending on the level of problem that the patient is experiencing.
Dr. Harrell, thanks for your time today. We've learned a lot of helpful information today, and I hope you at home learned something as well.